Most dentists think the way to grow their practice is to get more new patients, more Google reviews, better SEO or AEO, more ads, more mailers, more social media. And listen, I believe in marketing. I built a practice from scratch. I did a startup, so you have to get people in the door. But here's the thing that a lot of dentists miss. More new patients will not fix a weak new patient experience. Patients will remember what you tell them, but they will 100% remember how you made them feel. If a patient comes into your office and the exam feels rushed, generic, confusing, or insurance-driven, then you just became another average dental office. And if you are another dental office, patients are going to compare you based on insurance, convenience, and price, not the experience. But if a patient leaves your office thinking, I have never been treated like that or been examined that thoroughly before, that changes everything. This is where trust starts. This is where case acceptance starts. This is where a differentiation in your community starts. And honestly, this is one of the biggest reasons that I was able to build my practice from scratch into a $2 million plus practice while taking 10 weeks off a year and being completely out of network. Not because we're the cheapest, not because I'm the fastest, not because we're the oldest office in town. We were not. We're brand new. But because we built a new patient experience that helped people finally understand what was going on in their mouth. Let's dive in. When I opened my office, I knew I was entering a competitive market. There were already a lot of great dentists in my town. There were very established offices. There were very insurance-driven offices. There were corporate-style offices. There were offices that had been there for decades. So what was I going to do? From day one, I knew we could not just be another option. We had to be different in a way that a patient that walked into our office could actually feel. And for us, it all started with our comprehensive exam. Not a quick look, not a, hey, yeah, let's just kind of poke around and see what your insurance covers and go with that. Not, hey, you need a crown, here's the estimate, please do it. I'm talking about a real comprehensive exam that considers your mouth as the gateway to your body. I'm talking photos. I'm talking a periodontal evaluation. We're talking radiographs. We're talking taking a medical history and actually considering how that might affect your teeth and your gums and everything else. We're talking about an airway and a sleep screening. Talking about your bite, wear, cracks, old restorations, inflammation, recession, risk factors, long-term stability, all these terms that dentists love, but it's hard to put into practice. More importantly, we had to help patients understand what we were seeing. Because patients don't buy dentistry, no one's excited to buy a crown or a filling, especially if they don't understand. They may trust you, they may like you, they may think you're nice. But if they don't understand the diagnosis, the fee will always feel expensive. And this is where I think a lot of practices struggle. They collect a lot of information, and they don't ever turn that information into clarity for the patient. They take x-rays, but they never really understand what they mean. They're just kind of showing this dark image on the screen. They perio chart, but the patient does not understand what bleeding and pocketing and inflammation actually mean. They might have a small intraoral photo and see cracks, recession, wear, or failing restorations, but the patient hears it as a random dental problem instead of a connected story of why it matters to them personally. So the patient leaves confused. Confused patients delay treatment. Confused patients say, I'll think about it, or I gotta talk to my spouse. Let me just go home and think about what my insurance might cover. That is the problem, and we have to change how we present it. One of the biggest shifts that we made in our practice was realizing that our exam is not just a clinical process, it's a communication process. It's a trust-building process, it's a leadership process, it's emotional. It is one of the main ways you teach the patient how your office thinks. It's the very first impression you get to make. When a patient comes in and we show them the photos, talk through their perio health, explain inflammation, show cracks, discuss their airway, talk about the risk factors with that, and connect everything together with their medical and dental history, they start to see that we are not just looking for cavities. We're looking at the whole picture. We are part of their healthcare team. And when patients feel that, they value the appointment differently. They value your team differently. They value your diagnosis and presentation differently. That matters even more if you're trying to build a fee-for-service or out-of-network practice. because how you make people feel is what they actually value. When you are not the cheapest option, the patient has to understand what makes your office different. You can't just say, "We are better," or "We're super nice," or "We're really good." They have to feel it. And the new patient exam is where they really first feel it. This is one of the reasons that Oryx Dental Software became so important in our practice. Not because software magically builds a great practice, it doesn't. You gotta have the tools and the implementation. A piece of software is not going to give you a clinical philosophy. It's not gonna make you comprehensive if you don't actually want to practice comprehensive dentistry. It's not gonna replace leadership or communication. But the right system can build the standard that you are trying to build. For us, Oryx helped give structure to the kind of comprehensive exam we wanted to deliver. It made it super easy. Having the right tool makes all the difference. It helps organize the information. It helps the team follow a more consistent and repeatable process. It helped make the exam less dependent on me, remembering every single thing in my head and how to communicate it to the patient. And that became really important as we grew and as we scaled. When you are the only doctor in a small startup, you can use brute force for a lot of things. You know the patient, you know your small team, you know the exam that you're gonna do, you know your communication style, you know your philosophy. But then all of a sudden things change. You start to add hygienists, you add assistants, all of a sudden you got a treatment coordinator. Before you know it, you've got another dentist in the office, you have an associate. Now you're really intrigued and you want to start adding sleep and airway dentistry. All of a sudden you're getting more new patients because you have such an amazing exam. You're adding more complexity. Suddenly, if the system only lives in your brain, the practice becomes very fragile. From scaling a startup, I did not want to do that. I did not want the patient experience in my office to depend on whether I was having a great day, whether I remembered every single detail, whether the team happened to be aligned that morning, because they aren't every single morning. I wanted the system to support the standard. This is where the real value of Oryx comes in. So if you're a dentist and you're building a practice, especially if you're starting from scratch, or you're just trying to move away from insurance dependence, here is how I would think about your new patient exam. A great new patient exam should create 5 things. Number 1 is trust. The patient should leave feeling like you were thorough, thoughtful, and honest, and you actually cared about them as a person. Not salesy, not rushed, not dismissive, let me just tell you what you need so we can get on to the next thing, but thorough. Number 2 is clarity. The patient should understand what you see and why it matters. If all they hear is tooth numbers and procedure codes, you missed it. Straight up. Number 3 is ownership. The patient should start to own their condition. Not through fear, not through shame, nobody wants to be shamed, but through understanding. They should be very clear on what is going on, what happens if I don't act on it. Number 4 is documentation. If it's not documented, it is really hard to scale. It's really hard to communicate. It's really hard to hand off to the next assistant or hygienist or dentist that's going to see that person and know what actually happened. And to be honest with you, it's really hard to defend. But number 5 is a path forward. The patient should leave knowing what matters most, what can wait, and what the next step is. Progress is better than perfection. That is how an exam becomes more than an appointment. That is how it becomes the front door to the entire practice. That's how you get people to buy in. I cannot tell you how many times a patient has said something like, "No one has ever explained it to me like that before." And that sentence is gold, because they're not saying, "No one has ever cleaned my teeth before," or "No one's ever looked in my mouth before." They're not saying, "No one's ever taken x-rays on me before." They are saying, "No one has helped me understand my health like this before and connect it to what I actually want out of my life." That is differentiation. That is what makes a patient trust you. That is what makes them refer friends and family that are just like them. That is what makes them come back even when you aren't in network, even when you're not the cheapest in town. So if you're building a dental practice, don't just ask, "How do I get more new patients?" Ask, What happens when the new patient actually shows up? When you're in that present moment, how are people feeling? Because that is where the practice is built, one patient at a time. That is where the patient decides whether you are different or average. That is where they decide whether they trust you or not. That's where they decide whether your office is worth coming back to, even if it costs a little bit extra. And if you build a practice that is more comprehensive, more profitable, less dependent on insurance, the new patient exam cannot be an afterthought. It has to be one of the main systems in your business. Your exam is likely going to be your best marketing tool because ads can get people in the door, but the exam is what makes people believe they have found the right place. For us, Oryx Dental Software has delivered on that and has helped us build a practice that I love coming to every single day. It's profitable, it's comprehensive, and it makes a difference in our community. I hope you enjoy content like this, talking through how we make patients feel. If you like what you see, please subscribe, tune in. We're putting out content every single week.